Hello there. Thank you for joining Connect Care Live. Today's topic is health savings accounts. A lot of folks have questions about health savings, and quite a few people are not aware of what this health savings is all about. This is the tool which empowers the consumers, folks. This is the tool, yes. And ultimately, we need to have an insurance reform where everyone is mandated to have health savings. So what is a health savings? Contribution, it's a health savings account is a contribution is 100% tax deductible. Number one. Number two, withdrawals from the health savings accounts are tax free. And number three, interest on the earnings, especially if they are divested in the markets, they are tax deferred. So there is triple tax benefit. And this health savings is yours to keep. Nobody has the authority other than it's you as an individual and a family. It is yours to keep. Even though contributions may come from several sources, it is yours to keep. What are the limits of health savings? If you are a single person, if you are participating health insurance program, minimum required is you need to have $1,350 deductible health plan to qualify. You have to have an insurance, not traditional insurance, high deductible health insurance, so-called high deductible health insurance, is basically your minimum criteria is $1,350. It is a deductible, so up to $1,350 you're responsible for it. And as a family, it's $2,700 deductible as a family. So up to $2,700, family is responsible for the payments. After that, insurance will cover 100% for all the catastrophic illnesses. To qualify for the HSA, you need to have a deductible health plan. How does this HSA, health savings plan, work? These HSA, health savings accounts, work with a deductible health plan. As long as you are participating deductible health plan, you qualify for an HSA. Automatically you qualify. If you have a deductible health plan and you can get a deductible health insurance policy, then you qualify to put money aside into the health savings accounts. The question, who can have an HSA? The qualifications are, you have to have a qualified deductible health plan, number one, not be covered under health insurance. You have to have deductible, not health insurance. And you have not to be enrolled in Medicare. And you have to be not dependent on, you cannot be a dependent to qualify. So that is the qualification for you to have a health savings account. What are the tax deductible contribution limits? Every person who has a deductible health plan, they can contribute up to $3,400. Every year, you can contribute up to $30. Now it has gone up to $3,600 every year. As a family, you can contribute up to $6,750, which has gone up to $7,200, if I'm not mistaken. As a family, you can contribute up to $7,200. If you have a qualified health plan Every year you can put money aside into, it's like an IRA, folks. You can contribute an IRA up to 10,000, whatever the limit is. Here, as a family, you can contribute up to $7,200. That money is yours to keep, and it is put aside without paying any taxes. And it has a triple tax benefit by having that health savings. If you are 55 and over, to catch up with the health savings, the IRS will let you add additional $1,000 to your contribution. If you're individually contributing $3,600, you can go up to $4,600. As a family, you can go from $7,200 to $8,200 contribution. So that's a tax deductible contribution limits. Are there any management fees? Wherever you are putting the money, you have to open the account either with, I personally have it with Optum Bank, which I set it about 25 years ago. Those days, but anyway, there was management fees very, very minuscule. So your HSA will pay for it. Health savings account will automatically pay for it. There are strict regulations how these banks can charge the management fee. So there is a fee which is minimal, which comes with the health savings plan. Do HSA plan work with physician and provider networks? Yes. It works with physicians, it works with hospitals, it works with all the diagnostic centers, physical rehab, pharmacy, it covers it all. These are all most of them. It's like you have either a debit card or a check, you can make a payment direct. And basically what you're doing is you're making a cash payment up to your deductible portion. Whatever your deductible portion is, you can pay up to it. After that, the catastrophic takes over. I wish even the Medicare, they do the same. Give us the contribution, whatever the Medicare pays to the managed care companies or full risk contractor. Give us that money, $1,100, $1,200. I'll buy a deductible plan with that money, and I'll put money aside. As a senior, I can put money aside into my health savings. I wish they do that. I wish AARP looks into that, and they need to change that Medicare. Instead of giving it to these full risk contractors and middlemen, this middle level agency, which are high risk. I would rather give the empowerment to the consumers like seniors to take care of their own health. Why not? That gives an added benefit to all the seniors, folks. In addition to your Social Security, that's different. I'm talking about healthcare. Can my HSA be used for dependents not covered by the health insurance? Generally, yes. Your spouse is covered. Your dependents, like if your children are under 21, it is covered. But over 21, if they're earning members, it's not covered. So they have to be, in general, yes. As long as you're contributing as a family, you're qualified. What about non-medical withdrawals? Non-medical withdrawals. Normally, if you withdraw before you're 65, there's a penalty, which has gone up. As a matter, it used to be 10% penalty. Now it is 20%. You cannot withdraw till you're 65. If you're withdrawing for anything else other than medical expenses, there's a 20% penalty starting 2020. But after 65, you can withdraw for non-medical expenses. There's no penalty, but it's taxable event. It is considered as an income. So you need to watch out, folks. You can only use those funds for your medical bills, whatever they are. What about the non-medical withdrawals? As I addressed earlier, if you're 65 and over, if you withdraw for non-medical purposes, that is a taxable event. You can also withdraw for non-medical purposes. There are three things. One is you have to be over 65 and you have to be permanently be disabled and you die. That's the only when you can withdraw. There are three things, three instances you can withdraw. Over 65, you're permanently disabled, number two, and number three, if you die. And when you die, basically, you have to designate the beneficiary. If you don't, automatically trustee takes over and it goes to the IRS. So you need to watch out on that. You have to designate your beneficiary when you have it. Can my HSA pay the premiums? Yes, folks, that's where the beauty about it is. If you're 65, it can pay all the premiums, co-pays, deductibles, pharmacies. You know, as a matter of fact, I would say Part D becomes redundant. I think the only exception is you cannot pay the Medicare supplemental, but you can pay all your co-pays and deductibles. You cannot have a supplemental. You have to pay from your pocket the supplemental coverage. But all the other things are deductible. All the other things you can use it for the, especially if you're responsible for 20% anyway, so you can use that 20% to pay your bills. One more thing I'll come to talk to you about is billing system. That's a separate topic because there's a big issue about surprise medical bills, transparency. I'll come to that in another episode. But the billing system ultimately will go away if everybody have health savings. You pay as you go through your debit card, through your check, or whatever means you can pay, PayPal. So you have all the amenities to pay the bills upfront. As I addressed earlier, can my HSA pay the premiums? Yes. What are the tax benefits? As I told you earlier, there are three tax benefits. When you're contributing, you don't pay taxes. When you're withdrawing, you don't pay taxes for your medical reasons. And you also don't pay taxes on the interest what you earn. These are all tax. It's almost like an IRA, folks. It is an IRA. It's another piggyback on IRA. I wish everybody should have an IRA, Roth IRA, especially Roth IRA, and everybody should have a health savings with the participation of deductible health plan. I wish government can invest on people who can't afford it, who are not employed, who are handicapped, who are uninsurable. They need to invest, even on people on Medicaid. I think EBT cards, electronic benefit cards, they should provide the health care through the EBT cards. The money saved should be going to their health care. They cannot use it for anything else. So people on EBT, people on Medicaid, people are low income, people are unemployed, they should have health savings too. As a matter of fact, I foresee this will be an amendment to our Constitution where by law, they should, like what they did to the mandatory insurance, Obamacare, they should mandate everyone should have health savings. We are talking about 320 million. It can be done if the government can issue a certificate of guaranteed coverage for people on Medicaid, people are in low income brackets, people can't afford it, they're uninsurable, and they qualify for that. The Health Review Authority, which is a public and private partnership, they should issue a guaranteed health coverage, and that should be covered by the government. And beauty is even the low income folks can participate in the health savings. that gives an empowerment to everyone, irrespective of their economic status. What are the qualified medical expenses? It qualifies most of it, majority of the drugs and recommended surgeries, hospital visits, hospital copays, and doctor's visits, testing done in the offices, telemedicine, telehealth. It pays for all. There are only few exceptions, folks. Surgery for cosmetics is not covered. Health club dues, number 2, is not covered. Illegal operations or treatments like abortions or whatever it is, they're not covered. Maternity clothes, number 5, it's not covered. Number 6, you cannot buy toothpaste, toilets, cosmetics. It's not covered, folks. Another question people ask is, are lump sum deposits are permitted? Yes. You can make a monthly contribution or you can pay a lump sum just before the year end. You can contribute $3,600 or $7,200, or you can make a monthly contribution. It makes sense. Whenever you contribute for a deductible plan, whatever the money you save, put it in the health savings. That makes a perfect sense. The difference, what you save, put that in the health savings. That makes sense on a monthly basis. Question: are there adjustments for inflation? Yes. Tax law allows the annual cost of living adjustments to the nearest like $50 increments. It affects the deductible limits, maximum out-of-pocket expenses, maximum annual HSA contribution. Yes, annual cost of living adjustment is factored in this HSA. Can I have an HSA and IRA? Yes, you can have both. What happens to my HSA when I die? A lot of people ask that question. As long as you designate your beneficiary, it goes to your spouse. You have to designate your beneficiary. You have a handicapped child, you have a person who is uninsurable. I think you can designate your beneficiary. It doesn't matter. So as long as you do that, it's yours to keep. When can I start using the funds in my HSA? Once your account is open, you can use it for your medical expenses. You have total control over the funds, folks. Yes, you have total control over them. Again, what expenses are qualified for the reimbursement from my HSA? Same thing, keep all the bills, whatever you paid. So just in case of an audit, you should be able to prove that these were the medical expenses to IRS. So all the medical expenses are, you can use the funds from the HSA. What about the catch-up contributions? When you're after 55, you just started the HSA, you can contribute additional $1,000, which I mentioned earlier, to catch up. The IRS lets you contribute additional $1,000 every year to catch up till you're 65. 65 and over, that's when you get the maximum benefit from the HSA. How does a new healthcare reform law affect an HSA? The near-term effect is limited. The long-term, basically, what will happen is if the government mandates everybody to have an HSA, with the Health Review Authority and government investing in Americans, they give certificate of guaranteed coverage. Once you get a certificate of guaranteed coverage, insurance companies have to participate in that, because if they don't, insurance companies are the losers. So I can bet you, as long as the government give vouchers or give certificates of guaranteed coverage, they are covered and the government is vested on the premiums. So these are the common questions we face in health savings. I've been saying over and over, the traditional insurance days are numbered. They need to be banned. I would advise it has to go to the level of auto insurance. Auto insurance, our body is almost similar. You can cover your body like an auto insurance. If you take care of your body, you pay low premiums. You take care of your car, low premiums. You take care of your health, low premiums. If you don't have any risk factors, you have low premium. And pre-existing illnesses, it doesn't even arise, folks. That's a non-issue as far as I'm concerned. Pre-existing illnesses, they have made a big issue out of it. Once you have your health savings, it doesn't even arise. It's all covered, folks. I wish everybody gets it. I wish our representatives in Congress gets it. I think, if I am not mistaken, our president is leaning more and more towards having consumer-based healthcare reform where everybody should have. I think it's by law, everybody should have health coverage, if that's what is mandated, through health savings. Again, it has to be consumer based. It cannot be insurance driven or provider driven. It has to be consumer driven, folks. I foresee America will be number one in healthcare, especially with the technology, folks. Technologies will pave us the way. That's another topic I'm going to talk about, how doctors can save money by participating in telehealth, telemedicine. The overhead costs will go way down. Same thing with the hospitals. By participating in technology, even hospitals can save a lot of money. One thing is, we need to deregulate healthcare industry, folks. That's where, like what we did to the airlines, we need to deregulate. There's too much regulation. It costs hospital per bed $10,000. Can you anyway justify that? I can't. Why do you have to regulate that much for the public safety? I understand the logic, but we need to deregulate this healthcare industry, especially hospital needs a break. Hospital, OSHPD, it's a joke. The way they come across, they implement. In the name of public safety, they ram you through all these regulations. We need to address that. Hey, I have no problem. I'm retired, man. I can say whatever I want because this is free country. You can express your opinion. But I've been through OSHPD. I've been through all these bureaucratic nightmare. If you do like this channel, participate, give some comments, hit the subscription button and hit the notification button. I'll keep knock on your door, and ultimately Americans will win. I'm positive that Americans always win. No matter where they are, they always win, folks. Again, thank you for joining us.